Hello, my name is Lee Kilpack, and today I'll be discussing Bartholin's gland infection. There are two Bartholin's glands, which are pea-sized and oval-shaped. They're similar to Cowper's glands in the male, which produce a clear mucus that's dumped into the urethra prior to ejaculation. You can't palpate them unless they're hardened or enlarged by a disease or an infection. They're located at about 4 o'clock and 8 o'clock in the groove between the hymen and the labia minora. The duct in the surface is made of columnar cells, which flatten when the duct is distended to form a cyst. An infection may sometimes result in metaplasia. This picture here shows the locations of the Bartholin's gland. As you can see, you're looking at about 4 o'clock and 8 o'clock, and again, you can't palpate these unless they are swollen or hardened. As far as the function goes, the secretion of the gland is colorless and mucoid and has a characteristic odor. It's produced mainly in response to sexual excitement when considerable amounts are poured onto the vulva to act as a lubricant for coitus. The gland continues limited activity after menopause. As you can see here, there are several causative agents of the infection of Bartholin's glands, including gonococcus, chlamydia, streptococcus, staphylococcus, and E. coli. The duct and/or the gland become infected and swollen. If the lumen remains open, the exudate is allowed to escape, and then the infection either resolves or improves, or an abscess will form. Sometimes the infection improves only to return again, which eventually causes the gland to become fibrotic. As you can see in this picture here, the gland becomes swollen and very noticeable. So an abscess occurs when the duct gets blocked by fibrosis and the exudate builds up inside. If it's not treated, the abscess can burst. Signs and symptoms include local pain, which can be severe enough to make it difficult to walk or even to sit. Upon examination, there is tender swelling beneath the labia majora, stretching and extending through the labia minora. So several labia and vaginal lesions can imitate Bartholin's gland diseases. In such situations, differential diagnosis should be considered for the abscess or the mass. Differential diagnosis include different types of cysts, including Gartner's, Skene's, sebaceous, vestibular, mucosa. It can also be fibromas, a hernia, hematomas, lipomas, endometriosis, folliculitis, chancroid, gonorrhea, syphilis, vaginitis, warts, or even cancer. As far as the treatment goes, there are several things that a patient should do. One is that the patient should get plenty of rest. Pain is relieved by analgesics and a daily sitz bath. As far as antibiotics go, there's ampicillin or tetracycline in chlamydia infection. The abscess should be drained at the earliest opportunity before it bursts spontaneously. In case of recurrent Bartholin's abscess, excision should be done after the infection is controlled. And here are the references. Thank you very much for your interest and your time.